can be a variety of vaccines can be used compared to the other two vaccines. The safety population studies was more than 16,000 and global experience was there of more than 20 years. For convenience, we know that hexavalent vaccine has maximum coverage and minimum shots. Fewer injections per clinic visit, reduced time loss for parents, increased efficiency, minimum stress and pain, and improved vaccine timeliness and higher rates of coverage. This is a on-time vaccination. Children born between 1996 and 2003. The three kinds of reaction. One is immediate anaphylaxis, the other is solicited, and the third is unsolicited reactions. So it could be local reactions or could be generalized. So you see, for both local and systemic reactions, the incidence is quite high for the wholesale what produces vaccine. For severe adverse events also, that is namely persistent screaming, hyperresponsive hypertonic episodes, seizures, encephalopathy, and even anaphylaxis, incidence remains high for WP vaccine. In the end, I would sum up, I think very much on time, that this three component hexavalent vaccine meets the 3 C's for more than 20 years, which has been used in clinical use for last 20 years. It has got supportive evidence for use in preterm infants beyond 24 weeks. There is extensive post-marketing surveillance showing acceptable tolerance in both preterm and full terms. Immune persistence, as I described earlier, there is for all antigens it is 7 years and up to 15 years against hepatitis B. There is widest documented co-administration option for any hexavalent vaccine, and it is highly immunogenic and well tolerated across a range of standard vaccination schedules. Thank you so much.
He is the final frontier. The last talk of this conference will be delivered by none other than Dr. Umang Arora, the star pediatrician of Meerut. And the session would be chaired by Dr. Vinod Garg sir, the treasurer and finance secretary.
Thank you. I think we all are tired. Definitely. This is a challenge from Dr. Amit. So,
Dr. Sharad Jain, please also chair the session. Sir, please.
introduction of combination vaccines targeting multiple diseases in one injection has proven to be efficient strategy in overcoming the challenge of introducing of new vaccines in current immunization program. There are multiple benefits of this vaccine. For the children, lesser breaks, lesser pain. For the parents, lesser visits, easy on the pocket. For the healthcare provider, more efficient time at hand, less incidence of needle prick injuries, and for the society or the nation, early achievement of the goals of immunization. But before we can introduce this vaccine into any program, it has to prove its worth. And it can only prove its worth if the immunogenicity and reactogenicity of the vaccine is same as the single antigen, the same antigen when administered alone. My topic is 3 C's of hexavalent vaccination, and 3 C's are confidence, convenience, and comfort. Confidence always comes when some renowned endorses the use, like WHO or ACVIP. And also, if we have authentic and robust data in the form of case control and cohort study to back it up. So, immunogenicity studies, efficacy, effectiveness studies, if done and they have robust data, then we can develop confidence in this vaccine. Convenience is like simplification of schedule, reduced breaks, and comfort is safety and global and clinical experience. Taking one by one, confidence, as I said, it comes when anybody endorses it. So IAP-ACVI has already given a guideline in 2018. I'll name it as A cellular as AP, wholesale as WP, and 2C component, 2 component vaccine 2C hexa. So 3C as 3C hexa. WHO position paper on producers in ACP says that we can use these vaccines, either of the vaccines, in the primary series. Talking about the comparison of the two efficacy of the two vaccines, WP, AP, multiple studies have been done across the globe, and we see that there is variability in the WP protection from 91 to 96, and there is a consistent AP protection. If we see if it is administered of 2 or 3 primary series. Infanix Hexa is the only DTP combo with approximately 89% efficacy data included in its label. In a German household contact study, it was given at 3, 4, 5 months of 500 individuals achieved. Similarly, in Italy, a randomized double-blind study showed an efficacy of 83.9% and a long-term efficacy of 86% after 5 years. This was about Infanix, but it was the efficacy was equivalent with the Infanix Hexa. This is a real-time thing that Infanix Hexa demonstrates sustained protection in real-world setting. This is a era of use of vaccine or the disease epidemiology for the last era, for the last century, and pertussis incidence seen till 1960 was very high, but with the introduction of DTWP, the incidence fell down, but the coverage was low, probably because of the reactogenicity or a safety profile. But when DTAP was, there was a high coverage and the incidence almost fell down to 0 by 2013. These are 3 Indian trials, and these 3 vaccines, the EZ6, 2C hexa and 3C hexas, underwent trials in India, and review was done by Chitkara et al. And was published in Indian Pediatrics. WP hexa was an open label randomized study, and there were 284 participants divided into 2. Imovax plus Pentavac D was compared to EZ6. 2C hexa was single arm study, 2 tertiary care hospitals, 177. Infanix Hexa had an open label randomized 4 tertiary care center study was done. 224 participants were there, and equally divided into 2 groups. One was given 6 and 14, and the other was given 2 for 6 months. Comparing the seroconversion for polio and pertussis, we see that there is almost 100% conversion